Okay? And the purpose is to protect the cells from light damage and from rust. It's our native Rust-Oleum. You know, it's the car treatments that we had. You know, when we were born, we had that factory rust protection, right? That was our factory rust protection. But unfortunately, as we get older, we lose that factory rust protection. Now, carotenoids. The three that are important are lutein, zeaxanthine, and mesozeaxanthine. When I look at those, I have 2 minutes, okay? When I look at those, I think of my grandfather, who was a professor of organic chemistry at the University of San Tomas in the Philippines. I look at those and they look like identical triplets. The structure is exactly the same. But we know, even in identical triplets, that they're not the same. One could be better at soccer, one could be better in music, one could be better in physics, right? They might look alike, but they're not. And where they localize tells me what their strength and role is. They're all potent antioxidants, and I'll show you how potent they are, and the order, who's the most potent. They're also the major pigment in the center of the vision. Remember I told you one of the risk factors was low macular pigment for macular degeneration? Well, the deficiency of this results in low macular pigment, right? Now, the sources of lutein and zeaxanthine are quite numerous. You have lots of supplements that can get it. The average diet is, except if you're me, because I don't like to eat vegetables too much, is around 1.5 to 3 milligrams. Okay? And you can get them from spinach, collard greens, kale, etc. But the dietary source of mesozeaxanthine is much rarer. And that's why it was not picked up in these dietary questionnaires that were done back in 1994. The berries over here are called goji berries, salmon, trout, shrimp, crab. I don't know if you recognize what's in the center. Anybody want to venture a guess? Anybody? It's from China? Well, they eat in China. No. Turtle. Turtle. Yeah, turtle soup. Okay? So imagine, you know, these are hard to parse out in a questionnaire, so that you're not going to pick it up in 1994. Okay? You're not going to pick it up in 1994. Unfortunately, the only good source of this nutrient now is a supplement. And another unfortunate aspect is that these guys have a patent on it. It's a patent coming out of Ireland that makes it so that nobody else can get it. So you can't get it at Walmart or CVS or whatever. It's a brand called MacuHealth. Their iSolutions is a sponsor, and the reason why they're a sponsor is because I found them, they didn't find me. when I found this out, because I'll share with you a data that really convinced me that this is, mesozeaxanthine is the critical carotenoid. This is a diagram of the eye, and where scientifically these carotenoids are localized. Let's say you have lutein. You think lutein, right? And you eat it. You know where it localizes to? The periphery. Remember the peripheral vision. Okay? You don't find any of it in the center. The zeaxanthine you find in the mid-periphery, which is those blood vessels there, you know, that delineate the arcade. But where do you find mesozeaxanthine? In the fovea and in the macula. Okay, that's a clue, right? That's a clue, right? That's probably important, don't you think? The other thing was a paper that just recently came out, and this is what sort of convinced me. Remember I told you what oxidation was? Well, you can measure the ability of an antioxidant, and it requires really very high technology, but Paul Bernstein, who's at the University of Utah, has the technology, and he measured the different antioxidants of lutein, zeaxanthine, and mesozeaxanthine. Okay? Lutein is good, 20. Its score was 20. Zeaxanthine was 25 or 30 or so. Mesozeaxanthine was almost in the 40s or 50s. Now, what was really interesting was that he tested an organic chemistry situation where he mixed them up and found out that if you mixed them up in a correct ratio, chemically they became a stronger antioxidant. It works synergistically. And that was 10 milligrams of lutein, 2 milligrams of zeaxanthine, and 10 milligrams of mesozeaxanthine. Now, this formulation has been studied, several studies. There's 4 studies coming out of Ireland, several studies on this sort of formulation and how it actually increases the density of the pigment in the back of the eye with this formulation as compared to just taking lutein or zeaxanthine alone. Now here's a case, again this is from Ireland, back in the, this is a patient who has drusen, okay? This would be an advanced dry AMD. And what you show in the other, this is after 9 months of mesozeaxanthine, it was called Macular Shield over in Ireland, now it's called MacuHealth. You have a definitive reduction in those rust deposits that we see after 9 months. Now, people will say that, yeah, you can do this spontaneously, sure. I haven't seen it to this degree. And I used to be in the reading center for University of Pennsylvania, and I would grade for several trials of drusen reduction, and I never saw this like this. Now, this is an anecdote. I'm not going to, but it really consolidates my hypothesis that if you can put Rust-Oleum around areas that are rusting, that you could actually cause a reduction. You also may stimulate those garbage men from getting out of retirement, right? So this is MacuHealth, and I'm not going to go over it too much, but again, they're a sponsor, and they're outside. They do have a patent, so you can't get this anywhere else. And if somebody does claim that, this Irish patent lawyer is going to stop them from doing it. I've talked to several vitamin companies already, and they can't put it in there. At least they can't advertise that they have it in. But they also won't have the exact ratio that's what's patented. Now I'm going to go over fish oils, and this is going to be the last thing. I know I'm going over. I apologize. But fish oils have several. The main thing about the eyes in fish oils is that they protect the retina from cell death. Right? They're like wearing radiation suits. And the way it does, and this is a pretty complex slide that I always talk about, it's the main component, it's a major phospholipid, is something called phosphatidylserine in the brain and the retina. Okay? And its main responsibility is to protect the neurons from dying. Now, we've done studies that have shown that if Alzheimer's patients who have a lot of brain cell death, they have low levels of this fish oil or DHA. If you show low levels of this phosphatidylserine, which is made from omega-3 fatty acids, then you'll have a lot of neuronal cell death. Apoptosis is just another word for cell death. So that's why fish oils are, it's a no-brainer. The thing is you have to get the right fish oil. And there are several brands of them. There's a lawsuit right now for many of the fish oil makers because they use, there could be contaminants in the fish oil that they don't check for because the FDA doesn't monitor this. Also, there are 2 different forms, and it's how you purify the fish oil. What is called the esterified form and what is called the triglyceride form. Now, the esterified form is really a chemical reaction when you separate oils with alcohol, ethanol. You can form esters. The problem with esters is that they're very bioreactive. So the way you can test your fish oil, whatever you're taking, is you cut it in half and pour it into a styrofoam cup. I don't see any styrofoam cups here. And if it melts it in 10 minutes, then it's the esterified form. And if it doesn't melt it, then it's probably triglyceride form. So take that one. Okay? So in conclusion, get genetic testing. Predict what your real risk is of going blind. If you are moderate to high risk, see eye doctor more often. Subscribe to the home monitor, stop smoking, and take the carotenoids. But I would take the carotenoids anyways. I take it, and I don't have any risk of macular degeneration, but I like my brain, and so I like to keep it that way. Thank you very much.